A return appearance by our favorite veterinarian, Dr. Jill Brady. Dr. Jill, welcome back.
Good morning.
How's things in the vet business? Busy?
Oh, wow. Busy. Yes, it's crazy. Summertime's busy anyway, and then now with the acupuncture, it's been really busy.
Before we talk about that a little bit, we're seeing the fireworks tents start to go up all across mid-Missouri. Kids are happy, pets maybe not so much.
No, not so much. Every year we get calls starting about now about people who are worried about their pets with the fireworks. It's very scary for them. A lot of people have pets who will hide, but other people have pets who do very destructive things or they can hurt themselves. So we try to help them out. There are some good anti-anxiety medications out there, thunder shirts. There's different options that are available to people. So I encourage them to call their veterinarians if they have a pet that has problems with thunderstorms. Even it's the same thing, phobias to those noises.
Explain to me thunder shirts. People have suggested them for my dog. Our princess is 10 years old these days and very cranky, and doesn't like thunderstorms. Tell me what thunder shirts are and what they do.
Thunder shirts that's the brand name. It's like a wrap for a pet. And the idea, it's like swaddling a baby. You wrap them up nice and snug, and it makes them feel safe. I don't know if you're familiar with Temple Grandin. She did a lot of research on cattle and cattle chutes and things like that. And she had found that actually when she put herself in something similar to a squeeze chute for cattle that they'd use for cattle, she noticed that she felt calmer and more relaxed. And so it's a similar thing with swaddling babies. Now, of course, some babies like that. My baby didn't, but and it's the same thing for dogs. Some dogs you can do that, and you want to wrap them up very snugly in it, and it soothes them. It makes them feel better. Doesn't work for all dogs, but there's a significant portion that it does help.
It's part of the thing, I guess, where she loves to get in very tight spaces, and
yes.
she sleeps in very tight spaces and very tight between furniture and under our bed and those kinds of things.
Exactly. She might be a good candidate for that then, because she's self-soothing. She's doing that because she feels safer that way. So that might help her. Yeah.
I think for a lot of people out there, they might have the misconception too, especially people out in the country who've got watchdogs, stock dogs, and all, that this isn't an issue for them when the storms come up or the neighbor kids are shooting fireworks and all. And it easily can be. It doesn't really follow any guidelines from breed to breed, does it?
No, it really doesn't. And, I remember growing up, my grandparents' German Shepherd chewing through the garage door to get inside one time when he was left outside. And you hear people tell stories like that, like you mentioned with your dog chewing through chain link.
Yeah, we had a bird dog chew through a chain link fence and ran off.
It's amazing. And they'll do that, and they'll run. They'll go. Sometimes, maybe your dog goes missing, and that maybe that's why, there was something that happened and they got scared and left.
Well, I was relating to you off air, not to leave anybody out of the loop, Doctor, that we had a German Shepherd whose absolute favorite thing on the planet was fireworks, right up to trying to catch the bottle rockets when they came out of the bottle. And that the dog could set itself up for injuries that way too.
Yes, yeah, I don't recommend that. That's the exact opposite, and I've never heard of that one before. That was unique to me.
Well, it is a challenge too, and you guys you and your husband been bird hunters for years and all, and sometimes you'll encounter a bird dog that's really well bred, because I can relate from my era that sometimes that dog won't hunt.
Just won't hunt. That's right.
It's that time of year too. I guess maybe a good segue with Dr. Jill Brady from Westside Veterinary. Talk about ticks and fleas, and especially, we hear so much about that this time of year, but heartworms are a challenge when the mosquitoes are out all year long almost, isn't it?
Right. Yes. Heartworms, a lot of people don't understand that heartworms are blood parasites. So you don't check for heartworms with a stool sample. We do a blood test for it. And we found out about roughly 10 years ago that there were some dogs that had been on the oral heartworm prevention year-round and were testing positive for heartworms. And they couldn't figure out why, because we've been telling people for years, well, there's no resistance. Well, lo and behold, they found out, yes, there is now some resistance to the heartworm preventions that are out there. So we started recommending, based on the American Heartworm Association's recommendations, to test for heartworms once a year, just as part of their annual physical exam. And so we've been doing that to be sure that we have a lot of people, clients, and I give my dog her heartworm prevention once a month, and sometimes a few days late, but once a month. And but that way, because if you even if you give it once a month, this dog could become positive for heartworms. So if you're not testing and you don't realize that, they can have those heartworms. And what they do is they go to the heart and they literally fill the heart chambers and they go into congestive heart failure. So if you miss that for a couple of years, your dog will look healthy, but it's not, and it will cause congestive heart failure. And once they get that, that's not reversible.
Will the inoculations for that help?
The
yearly shots.
So usually the yearly shots that dogs get are for vaccinations. They do have a heartworm injection, yes. That's called ProHeart, and that's good for 6 months. And as far as I know, I believe that's the only heartworm prevention so far that they have not seen that resistance with. So we have quite a few dogs that we do the heartworm injection, the ProHeart shot for. Yes. Mm-hmm.
Dr. Jill Brady in with us, Westside Veterinary, KWOS Open Air, 556-6397, our number. Come back and talk about the obvious, talk about ticks and fleas and some of the treatments that are out there as well, because those can really set your pets up for some serious illness as well. With the doctor on KWOS Open Air. KWOS Open Air brought to you by Arts Pest Control. You stay, they go, 556-6397. John Marsh, Dick Aldrich, Dr. Jill Brady in with us from Westside Veterinary this morning. Ticks and fleas, the big story, and how effective are the treatments that are out there right now? The once a month kind of thing.
Yeah, there are some really good ones out there now. I'm pleased. Of course, we've had Frontline, Advantage, Advantix around for a long time. A lot of the topicals have been around for a long time. The once a month. Now we've got NexGard, which is a chewable once a month, which does fleas and ticks. They've got some good. I've never been a big collar fan for fleas, but they've got some good collars out there now too that work very well for fleas and ticks that last 6 to 9 months. So those are really good as well. Definitely much better than what we used to have. I remember the days when we used to do a lot of dips for fleas and ticks, and that was not fun because you had to wear gloves and
been there, done that.
Yeah, it was not real safe for the animal or the person giving the dip either.
Pretty strong stuff.
It's really strong stuff. If you've ever smelled it, it's of course you probably do that, and you're probably tick repellent for a few days after you do a dip. But no, there are some really good flea and tick products out there. So and they're very affordable too. Frontline is now you don't have to buy it from a veterinarian anymore, so it's very readily available to people as well. So
are dogs and cats more predisposed to some kinds of tick-borne illnesses than others, or are they kind of like people? You can kind of get most of the ones making the rounds.
Right. They can get most of the ones making the rounds, definitely. And after listening to Dr. Link on your show the other day, I was thinking about how that does make it even more important to keep some sort of flea and tick prevention, especially for ticks on your pets, just to keep yourself healthy as well. So they're not hopefully bringing a lot of ticks and stuff into the house. So it's important. But they certainly get Lyme's disease, Rocky Mountain spotted fever, Ehrlichia. I haven't seen any cases yet this summer, but I'm sure we will soon. So, but again, I think most people are really careful about keeping their pet on some sort of flea and tick prevention.
I think we talked last time when Dick was in, when the misconception of people out there saying, "Wow, my pet's inside. He or she just goes out to do their business," and is that really an issue for fleas and ticks for them?
Right, it is. Anytime a pet goes outside to do their chores or go potty, they are at risk for getting fleas and ticks. And of course, I work in an environment where there's a lot of fleas and ticks. I've taken fleas home on myself from or people walk out in their yard and they bring ticks inside themselves. So really, it's even though your pet may not spend all of their time outside, they are still at risk.
Yeah, we think that our dog has brought ticks to us from time to time in from outside because she was, like John said, she just goes out to do her business and comes right back in. But she will wind up with ticks. And also, knowing from experience, you don't want to get fleas in your house either. I one time rented an apartment where a gentleman had several cats And we took over the apartment and came in, and literally clouds of fleas would jump up as you walked across the floors, and we had to bomb 2 or 3 times to get those out of there, and it was not a pleasant experience. So, I mean, they can infest and go pretty quick.
Yeah, it's crazy. I can't remember how many thousands and thousands of, for every tick or flea that you see, how many are actually in the environment already. And the flea life cycle is such that it's about a 2-week life cycle. So you typically have to treat your house and yard and then treat again in 2 weeks. And then even so, we usually tell people it can take a few months to get rid of fleas once you get them. So it's like heartworm disease. It's like any of those. It's a lot easier to prevent than it is to try to deal with the results later.
Dr. Jill Brady with us, Westside Veterinary on KWOS Open Air 556-6397. Got a lot of comments when you were in with us before, Doctor, talking about your acupuncture practice all over in there. We could revisit that discussion a little bit and talk to us about some of the great results you've seen with some dogs who've had some rear leg paralysis.
Yes, we've had some really, really good results with that. We've had a couple of dogs that had back problems and that we treated with acupuncture, and had one case that had a surgery and was even with the surgery was having lots of difficulties walking, and we were able to get him up, and he's able to do stairs and play with the other dog and basically have more of a normal life. He still has some neurologic issues, but they're much, much better than before. We've had a kitten that was attacked by a dog that was paralyzed in his back legs. And by the time he left us, he was up and playing and climbing the scratching post, and it was pretty amazing. So I see a lot too of cases here lately of older dogs that are coming in that have weakness in the hind end. Not so much that they can't walk, but they're very weak, lack of energy. I'm treating some patients right now for just some behavioral type things, just to kind of help. I think with anxiety, it helps with stress, things like that as well. So we use it for that. So it's been pretty busy here lately with the acupuncture.
What is the cost of the acupuncture a lot? Is it an expensive therapy, or is it? I'm sure it's cheaper than surgery, obviously.
It's much cheaper than surgery, and it's kind of like a lot of things. Initially, most cases I'll see once, or sometimes, depending how severe it is, twice a week for about 6 weeks. So your cost initially is more, but then once they start to ideally respond and do better, then they may come in once a month. They may come in as needed. So the nice thing about it is if you have a dog that is having issues walking or has weakness and is on Rimadyl or pain medications, things like that for them, sometimes we can cut back on the amount of medications they need to get. So you save money there. And then once you're kind of getting maybe a tune-up every once in a while, it's cheaper than within the medications.
Kind of having a discussion over Facebook with a friend of mine who has a Labrador who's about 7 and having trouble with his back legs and walking, weakness and that kind of thing. And several people had recommended acupuncture. He went with a laser jacket looking type device. I'd never seen anything like it before, and it's apparently it's something that is working. But he also is medicating with glucosamine and those kinds of things. Is that right? A good way to go?
Yeah, I use glucosamine a lot. I recommend that a lot. I use it myself a lot on myself. But I recommend it for a lot of pets because glucosamine helps in the joints. So if your pet has a joint issue, it really does make a difference. But like a lot of things, the glucosamine, the nutraceuticals, are better if you start them early as opposed to when they're really lame. So it's something where if you have a dog that is 6 or 7 and you start to notice issues, they're a little stiff in the morning, they're not quite as energetic as they used to be, start it early and it works much better for you. I have not heard of the laser jacket. I'm going to have to go check that out. That's very interesting. We do use a lot of lasers. There is laser acupuncture, definitely, that you can do. Oh, there it is.
Dick brought the picture up on Facebook.
Wow.
Yeah. He's even got one on his back. So,
Wow, that's pretty cool. Yeah, and I'm sure that the laser therapy does work, and I know there are some other clinics in town we do cold laser for treatments for wounds and things like that. I mean, there's a lot of great alternative medicine options out there for pain. It's amazing, which is great, because if we can get a lot of these pets off of a lot of the drugs, then they're happier, their owners are happier. It's just better all around for them.
I remember back in the day, it seemed like kind of the catch-all prescription, especially for older pets from the vet, was, give them a baby aspirin.
Right. And I have nothing against baby aspirin. I think I've recommended it in a pinch for people to use for their pets. It's okay for a day or two, but long term, there are definitely better options as far as non-steroidal anti-inflammatories out there.
And like you said, it's all about preventative care, and maybe a quick reminder to folks on vaccinations. You have to keep them up to date, or it just doesn't do your pets any good, does it?
Right. You definitely want to keep your pets current on vaccinations. Right now, that's kind of a hot topic. What with people and not wanting to vaccinate their kids. And I think in New York City there's a big anti-vaccine movement for pets. And the idea with pets is, we know there are certain diseases out there that we can prevent, diseases that will kill them. And vaccines are very, very useful in animals for those diseases. And what we try to do is we try to vaccinate them enough to keep them covered, but not over-vaccinate. So at Westside, we use the 3-year distemper parvo vaccine because it lasts for 3 years, but we don't have to give it once a year. And we follow the Cole County protocol of the rabies vaccine every 3 years instead of once a year because we want to protect those pets, but we don't want to over-vaccinate. Yeah.
Very good. Dr. Jill Brady, Westside Veterinarian Doctor, pique some interest out there. They need some treatment. How's the best way to get in touch?
You can give us a call at 893-7707. You can check us out at our website, westsidevetjc.com.
Very good. Thank you, Doctor.
Thank you.
See you next